Hello, I'm so excited to step into your space today. You're welcome to the platform with Dr. Ivy. Today I had a very interesting experience at work. A 25-year-old nursing mother walked into the consulting room in the company of her husband as they carried their 2-month-old baby. They gave me a history of the baby falling off the couch in their sitting room. Yes, the baby fell off the couch in their sitting room, so they were very afraid and wanted to know whether their baby was okay. I took a history, examined the baby, and thank God the baby was okay. So I counseled them, sent them home on a prescription. However, after they left, a lot of thoughts went through my mind. I realized that a lot of parents and caregivers are unaware of the fact that the home can be a death trap. Yes, the home can be a risky place where accidents can occur and that can lead to the death of the individual or maiming of the individual. That brings me to the crux of the matter. Today I want to talk about an important topic that can change the life of a person right there in their home. It can even result in the death of a person, the victim, right there in the home. That brings me to the topic, a very important topic. That is home accident or domestic accident. I'd like us to look at the definition of home accidents, the modes of presentations, the risks involved, the ways to prevent it, and the likely things to do in the face of a home accident. When a victim is involved in a home accident, a dear one is involved in a home accident, what would you do? Okay, let's begin. In my own words, I like to define home accident as a sudden and unintended occurrence resulting in injury or a threat to the life or even death of the victim in the home. It's sudden, it's unintended, and it's unexpected. As the word sudden refers, it occurs leading to injury or threat to the life of the person or even death of the victim in the home. Remember, home is not just where we live. It includes areas of confinement like the mentally destitute home, motherless babies home, even a home for old people, and even in boarding houses. Any sudden occurrence or an accident resulting to injury or threat to the life of the person occurring in such places is referred to as domestic accident or home accident. Now let's look at the presentation. It has so many presentations. For instance, the baby that came to the clinic today presented with a fall from a height. That's number one, fall from a height. That includes also falls in a bathroom. What we generally know as bathroom accident is a fall from a height, and there are people that are vulnerable to it. Number two is laceration or cuts. That's the skin is severed by a sharp object. It could be a broken bottle, it could be a knife, a sharp knife in the kitchen, or a sharp machete, or cutlass, or a shovel that one could be gardening with in the compound. Now it gives the person a cut that bleeds and might require the attention of a medical expert. In addition to the cuts, we have burns. Burns occur from either naked fire or steam that can give someone a scald from a cooking pot. I remember I've had an experience where a couple of boiling water fell off my hand and sprayed me with hot bath. My skin peeled up, my entire legs peeled up, and thank God, with the attention of our doctors and our nurses, and over a space of weeks, close to a month, I got well with minimal scar on my skin. I'm really very grateful. It's an experience nobody would ever wish, even for your greatest enemy. Now, the next one is bites. You can have bites from your domestic animals like your cats or your dog. You could also have bites from insects like bees, wasps, or you can have bites from spider, itsy-bitsy spider, or snakes that move around in the garden while you're tending the garden. The next one is drowning. Drowning can take place in the bathtub. For instance, a baby can be so mischievous and put on the faucet, run water into the bathtub, and mistakenly fall and drown inside. That's why it's not advisable for parents or elders or significant others to allow babies unattended in the bathroom. Drowning can also take place in the swimming pool, right there in the compound. Now, the next one is poisoning. Children can swallow disinfectants or poisonous chemicals like bleaching agents or other chemicals in the house that are not properly placed. They can gulp it, thinking that it's a healthy drink. They end up with poisoning. I'm sure you heard about kerosene ingestion. You know, kerosene, the fuel for cooking. A lot of children have fallen victim. I know one of my little brothers took a bottle of kerosene that was stored inside a drinking bottle and gulped it down. He started choking on it until we took him quickly to the hospital and the doctors intervened. And today he's well and already in the university. I just thank God for saving that life. That's for poisoning. Apart from poisoning, you can also have foreign body in the nose, foreign body in the ears. Children, especially those that are the young babies that are decorated with beads, they can stick it in their nostrils or right into their ears, or can stick an object into their eyes. Some of them even swallow foreign bodies. I know of a case of a little boy that swallowed battery. You know, battery, swallowed it. He was just putting it in his mouth, rolling around and playing with it in the mouth and swallowed it. We had to take him to the emergency. There is an emergency unit where he was attended to by our doctors. Such things can happen at home. Apart from that, you can have drug overdose. Children can take up cough syrup and gulp it down. That's why we advise keep medicines out of the reach of children. Or even the elderly can miss their prescription, especially when they have senile dementia. They can pack up a whole set of pills and swallow. I remember my grandma. My dad told me that my grandma died from such a thing. She took about 5 tablets of a particular medication that we were using that time. They called the medication Librum. She swallowed 5 of it for a headache, and she pegged off. She died from it. So there are cases of overdose. We also have electrocution. Electrocution has to do with a type of home accident that results from contact with a live electric wire. It could be from a faulty appliance, either in the bathroom or in the kitchen or in the sitting room, or even from electric iron while ironing your clothes. Besides, when children start crawling, when toddlers are crawling, that's a high risk time. They can stick their finger, poke their finger into sockets. And that's why we advise young moms, young parents, caregivers, cover the sockets or raise the level of the socket so that the kids will not stick their finger into it. Finally, I'd like to mention suffocation or choking. I'm sure that you have bought some items that were wrapped in cellophane bags, and on the cellophane bags you notice an indication, a warning there. Warning, keep away from children, can cause suffocation. Such cellophane bags can choke a baby, especially with babies that play with them as toys. They can put it over their heads or stick it down their throat and they choke on it. That's why we advise parents and caregivers to keep those things away from the reach of children. Dispose them immediately or keep them away from the reach of children. Now, what are the risks involved in home accident? First, there could be bleeding, excessive bleeding, what we call hemorrhage. Some can be minor, from abrasions or cuts or falls. There could be a minor bleeding that could just be taken care of at home by first aid, or will require stitching or suturing in the hospital by a medical expert or a nurse. Next, there also can be shock. If the bleeding is much, the person can go into hypovolemic shock. That will also be treated in the hospital. There could also be the risk of fracture. In the elderly, the aged, they are prone to falls. Fracture simply means a break in the bone. It can be visible externally or it can be hidden underneath the tissue. Either way, there are symptoms and signs to look out for to know there has been a fracture. And whenever a person suffers a fracture in the home, it's advisable that you don't move the limb. Rather, if you are conversant with first aid practices, you splint the leg either with cotton or a plank with a bandage or a piece of cloth. Immobilize the limb, because when you try to move the limb that has already broken inside, there will be more damages. It can snap into two. If it's a simple fracture, it can even become more complicated and commuted. So we advise, don't move a limb that is broken. If you have to move it, splint it to immobilize it before you can move it. Those can be taught in a first aid intervention at homes for cases of domestic accident. I would like to also point out that in the elderly, they have a characteristic fracture they suffer. It is known as pathological fracture. It is a fracture that results just from simple falls, a minimal fall. The hip can be displaced or the femur can be broken. So when we are planning where to keep our elderly patients or elderly relatives, we need to put it into consideration. Now, apart from fracture, we also have choking and suffocation. That's part of the presentation of home accident. In that case, for instance, when nannies or housekeepers feed babies, especially babies that have difficulties in feeding, they'll turn the babies upside down and pour in the cereal or the pap straight into the mouth, clasping or clipping off the nostrils of the baby, so that at the point the baby tries to inhale, the baby sucks in the food straight in. But the unfortunate thing is that at the point of sucking the food, the baby can inhale the food into the lungs. The baby aspirates, chokes, and begins to cough. In the process, the feed or the cereal that's been aspirated into the lungs can begin to cause a reaction in the lung tissue, resulting in what we know as pneumonitis, chemical pneumonitis. That's also what happens with kerosene ingestion. So we need to be very careful who we leave our babies to or how we allow our babies to feed. Even after breastfeeding a baby, if you don't wean the baby appropriately and lay the baby down, the baby can aspirate the breast milk and it can be life-threatening. So young mothers, older mothers, let us be careful how we handle our home front. God will keep us safe in the mighty name of Jesus. At this juncture, I'd like to draw our attention to another important aspect of the risks involved in domestic accident, and that is carbon monoxide poisoning. Carbon monoxide is an odorless, colorless gas that is emitted from the exhaust pipes of generators. Remember, in our environment, when we don't have the regular power source, we switch over to alternative power supply through solar panels or generating sets. Now, use of generating sets can be good, but very risky because the exhaust fumes emit carbon monoxide. Carbon monoxide, like I mentioned, is colorless and odorless and can kill people through asphyxiation. Carbon monoxide replaces the oxygen in our tissue, and the tissues are starved, the brain cells are starved, and the person passes on in their sleep. It can wipe off an entire family. I'm sure you've seen it in the media where people put on generating set either during a night vigil or throughout the night, and they end up passing out. A whole family of 6 can be wiped out. The Center for Disease Control, however, advised that we should put our generating set at least 10 feet from our living area, from our places of habitation. They discourage us from running our generating sets in our garage or in our homes or even at the staircase. It is very, very risky. You might not be alive to tell the story. That will not be a portion in the mighty name of Jesus. As a final note, I'd like to emphasize the importance of safety in our homes. Treasure it, teach it, enforce it in your family. Falls that babies had in the distant past can result in seizure disorders much later in their adult life. All of a sudden, the person begins to fit without cause. When you take a history, we usually find out that it has its origin in the distant past, an innocent fall in childhood or even as a toddler. Therefore, let's avoid it by all means. Remember, death can occur in the house, so keep your home safe. The book of Job chapter 5 verse 24 says, "You shall go out and return to your habitation and find it in peace." That's what will be our portion. We will go out and find our habitations in peace. Till my next video, remember, stay safe, secure, and healthy. God bless you.